with 500 plus providers and hundreds of different clinical organizations across the country to really build and apply predictive analytics to help with their hospitals' workflow systems and strategies concerning patient pay collections, patient pay vendor management, presumptive charity, and population health. Now, the interesting thing about who we are as Conance is how we go about doing that. And one of the things that we really pride ourselves in is that uniqueness, and it's where we get those outcomes and predictive analytics from. And it's really from a different set of data that you would normally probably use in that process. I think a lot of what you see in the market today, especially when it comes to propensity to pay or any other kind of predictive analytics dealing with revenue cycle and financial outcomes, really deals more with your credit scores. And we really do the opposite. We steer away from credit scores. In fact, we don't use credit scores at all. What we've really done is try to find different segments of data throughout the system to give us better, more accurate strategies and outcomes and solutions to help us to predict and create strategies for our hospital partners. And we get that data from a couple of different areas. One, consumer data. So we're pulling and using, and Marcus just walked in. Welcome, Marcus.
Hey, guys, doing?
Good. So we did introductions, but we'll sneak you in there. So with the consumer data, we also blend it with some socio-demographic data that we're using, as well as hospital historical data. And so the blending and kind of meshing of those different data sources really creates a unique outcome and ability for us to really start to predict actions that need to be taken when it comes to patient pay. What it does for us, and David will jump into this here shortly when we start talking about our segmentation piece, is it allows us to be a lot more accurate. It also allows us to cover 100% of the patient population, whereas credit scores really don't. There's a gap in the credit scores as far as what they can cover. And it also allows us to really start finding some unique and interesting insights into strategies that the hospital can pursue, the hospital or the provider organization can pursue to really streamline that their patient pay arena. In the industry as a whole, what we're noticing is patient pay is becoming a bigger topic. Overall, self-pay is increasing with the ACA and everything else that's out there. High deductible plans is kind of the thing of the future. And so as that kind of, we start rolling into those more and more high deductible plans as we see them from year to year, it really becomes necessary for us as hospitals or other organizations to really start looking at what is our strategy going to be as we start to see that self-pay increase. And are we going to follow the definition of insanity, and that is, are we going to continue to do the same thing over and over and hope for a different result? Or are we really going to look at how do we do these things and what are we doing and how can we tweak them to make them better, more efficient, and more streamlined? And really, that's really what we at Conance are trying to do, is to really provide you with that insight, those strategies, and those predictive analytics to show you this is really where you can make the biggest bang and with the differences inside of that, the patient pay and self-pay side of the house. So moving on, we've had the privilege to work with a lot of different provider partners across the country, a lot of quality, great providers who've partnered with us to do just that, really break down a lot of their patient pay and self-pay, work through us on some predictive analytics, and really work on getting those efficiencies and strategies created so that they can move forward in this new and ever wonderful healthcare world. And so these are just a few of the partners that we have across the country. This isn't all of them, but this is just a few, with a few of the outcomes that we've been able to help them with. And so, and a lot of it is significant. If you notice, there's not just little things here. A lot of it, we were actually surprised at what we could do and what we could show them and how we could help benefit them at the end of the day. So with that, I'd like to turn the bulk of the time over to David so that he can really jump into the hows and the whys and what we're doing.
Can I ask a question?
Absolutely.
Of course. That was the ground rule.
So I'm really interested to see the segmentation solution, but the sources of data is something that I'm really interested in.
Okay.
So you said the socioeconomic data, I assume.
Talking about how do we stratify the AR so we can work the patient responsibility in the most effective manner, right? So some of those answers, I will get to your answer. Some of those have to do with, are we going to try and collect from them, right? And so it's our outbound effort to get the cash in. Some of it's going to be about, do they meet charity? For us, an important piece is those are actually separate models. So I say this as preface to your data question because we think about the data slightly differently for both of them in terms of the approach and what goes into it. The reason they're separate is important from sort of the science of predictive modeling, which is predicting how much somebody is going to pay on a patient responsible bill and how they're going to engage in that process is a fundamentally different question than do they live in poverty, right? And so whereas some of our competitors use kind of a broad propensity to pay and say low propensity to pay, they can't pay, so therefore they must be poor, right? We take a different approach. We say we're going to ask those questions and try and drive business decisions with those. We want to actually align the models with those choices. Okay.
Okay.
So, but I haven't answered your question yet, so now I'm going to, unless you want a different question.
Well, just sort of in addition to
Go
that
for
one,
it.
the consumer data. So before we kind of get started, I want to understand the differences in each kind of data, which would be different than the solution that we're already currently using. That's why we're so interested in it.
Right. So the so let me talk about the propensity to pay side of this first, and then I'll talk about the charity data. So when we think about the world of propensity to pay, we're trying to do something slightly different than simply propensity to pay. So typically a propensity to pay solution is going to provide that collection to maximize the results or minimize the cost associated with it. As we do that, there are three broad categories of data that go into that model. First is going to be information about the visit. So we're going to look at some things which won't necessarily be very surprising to you, but we've quantified in terms of their impact. So think about things like, is the patient balanced after or uninsured? Think about things like, are they inpatient, outpatient, or ED? You guys know those things matter, right? We've quantified those in application. Another one that sits in that bill is, how long has it been since discharge or service to the time we're scoring? Right? The longer we wait to start engaging the patient in the collection process, the lower our recoveries are going to be. So that's kind of bucket one. Bucket two is historic payment information for that guarantor to your facility. And so one of our strategic partners is FICO, or Fairisa. And they, well, you probably know them related to the FICO score itself. We don't use any credit bureau data, but what FICO really is they're probably the world's leading experts at predicting consumer behavior. And so they worked with us to understand historic payment behavior within healthcare, right, to be able to bring that into the model so we could understand how people have paid or not paid their bills in the past relates to their current obligations. And then the third piece of data for this is a range of socioeconomic demographic data. So it's going to be income, it's going to be some asset data, it's going to be some lifestyle indicators. A bunch of it is at the household level where that's available. Some of it will be census level as well. And so it's a broad spectrum of things, Amanda, in terms of what goes into there. But those three things in combination allow us to build this suite of models. And part of this and part of how we went about building these models is we started from the premise that there isn't actually a broad, where there wasn't, a broad pool of healthcare experience, payment experience data available in the market, right? So if you look at credit bureaus, very little healthcare debt or full payments are reported to the bureaus, and that which is reported is masked to be neutral, right, just as medical. So it doesn't really tell you much. And so we generally believe, and our clients generally believe, that consumers pay their medical bills differently than they pay other forms of consumer credit. So if that's true, then we have to go get a data set of healthcare payment behavior and build that as the source of model. Contextually, all these pieces coming together?
Mm-hmm. So can I ask a question then? So you're speaking to the different types of socioeconomic data. What exactly are you using for that? Like, what are you pulling from that determines?
Right, so we go to a range of third-party sources, which we generally don't disclose. In terms of who those providers are, none of them are credit bureaus,
okay.
But they are things like public record sources or marketing databases or other consumer aggregation tools.
So if when you pull the data, does it result in a soft credit hit for the patient, or is there a credit hit? Like
there's absolutely no credit or soft hit.
Okay.
So we do not use any credit bureau data, and that has an advantage in a couple forms, as at least from our client's perspective. One is our client, we tend to work with large not-for-profit health systems who don't want to have soft hit on their patients. So that's kind of one, and so we align with that. The second is, in our experience across the country, only 25%, maybe 30% of patients don't have a credit score, or their credit file is too thin to be scored. And so in those cases, our clients typically, if they were using a credit-based solution, look at that universe, call it 30%, that would be high risk, right? And so therefore, high risk, when you start to think about it from a default treatment pathway, what in our experience, that's actually not true. Impact, past behavior, some other information about them, and their socioeconomic. We can now actually uncover those subset of patients that wouldn't have had a credit score, but actually would pay and how to best engage them in that process and drive substantial collections out of that group.
Well, in a lot of, I'm from Idaho, and similar to Oregon, we've got a lot of rural communities where they don't believe even, but they've got a lot of money and they've got a lot of assets that they can say, hey, look, they'll pay their bill, but they're just not going to pop up on a credit score and look very good. You also have students that are joining, that don't have credit because they're just getting started. That doesn't mean that they're not going to pay. It just means, and so a lot of this is really just kind of figuring out, instead of just throwing everybody in a bucket and saying just because you have this score, then you're probably not going to pay. We can really kind of fine-tune that and filter the ones that we think will, and then actually predict the action. Also what they're going to take, but what needs to take place to get them to pay.
So I would assume then with this data, you're able to get some of the folks that are maybe undocumented and that type of thing as well.
Yeah, that's right.
Right.
Let's see if this works. For some reason, I have a disconnect between my slideshow and at the risk of bouncing around, if you'll be okay with that.
I'm good now.
No, I wanted to answer the charity piece of it.
Oh, okay.
Because I know I only answered one, so I'm going to kind of do a little bit of the understanding. And I'll come back and do more detail on the charity analytic as we kind of go through it. But, right, so this is a purpose-built model to look at and predict whether patients meet your financial assistance policy. There are a couple ways we do this, and again, this is not, there's no credit hit on this as well. We're not simply saying, right, credit score, bad credit means you live in poverty, which is not true. We're also not simply taking kind of the low end of an FPL scale to say you're not likely to pay, so therefore you live in charity. What we are doing here is a multi-factor approach to discern whether someone lives in poverty or not. So one piece of that is going to be basically a socioeconomic index, which has a whole number of factors which we've proven through our data modeling correlate with whether someone lives in poverty or not. The second piece is going to be an estimated FPL, which we bring to bear here as kind of a check on that system, and then there's an asset test. The reason we do it this way, leveraging a lot of socioeconomics rather than simply an FPL estimate that you could get from somebody else, is FPL estimates have pretty big error rate. And so we've seen other FPL vendors or income vendors, right, estimated income vendors, say that 80% of the time they tell you the household income is up to $35,000. It could be up to $50,000. Others have said that their error rate is $15,000 to $20,000, right? And so if we're trying to find people at the low end of the scale, that do come into this model, again, public records, lifestyle, you can get a feel for the types of stuff that comes into that as well. But it's a different approach. And as we get into the charity piece, the other thing I'll say that is quite different than what other people do out there is we're going to calibrate our models to your specific policy and your patient mix so that we know through statistics up front that the rules we're going to recommend for what qualifies is consistent with what you've done in practice historically. Does that make sense? Any questions on that? Marcus?
Not really.
Okay, so now I thought I'd go through sort of the propensity to pay side of this first, and then we can come to the charity side in terms of the pieces and the application and how it works. So talk a little bit about the logic, right, which is we're trying to segment people based on how much we're likely to collect and how they're going to engage in the process. This is the simple segmentation map for what that is, right? So the horizontal here, expected cash value, how much are we likely to collect, and the vertical is how that patient's going to engage. And so when we start to think about that, and I'll show you some example data in a second, right? That lower left corner where it's labeled conserve for segment 1, right? We're not likely to get a lot of money, right? And not a lot of patients are going to engage. So I'm not saying don't do anything. I would do the minimum that your policy requires and no more because it's not really worth the upside. Then we can start to think about those segments 2 and forwards as wait and watch, right? Not necessarily the most value on the table, but we're going to have engaged patients in that process. These are places where statements can do the job for us, right? Or maybe we supplement with some outbound blast messaging, but we don't necessarily have to engage too early in a process because they're likely to self-cure. And then that far right investment grid is where we think there's a lot of money on the table, a 50-50 chance effectively, right? And this is where if we're moving resources, right, so we're no longer just doing a balance or as an outbound strategy for calling, we can divert them to that segment, we can actually have a real impact, right? Because we can make more call attempts there where we can, if we penetrate that inventory and get to the patient, they're going to engage with us in that process and it's going to make a difference. That's a place where we think about aligning resources across a business office. If you have a set of collectors which are more experienced and better kind of with the patients, and you can skill match, right? So when your outbound program, you put segment 5, you direct those calls to that set of staff, right? And then you put new people maybe in segment 1, right, where it doesn't really matter as much, right? And it's a kind of a training ground. And so you can think about a progression of staff as well as we start to align resources across the street. So some data that just kind of tells that story. And this is something that we come back to routinely with them, because we want to make sure that the segments actually are performing differently. Segments performing differently is a test of whether the segmentation is good and therefore actionable to drive different results. So when you look at this page, the two rows I would draw your attention to probably most specifically are the unit yield one and the one which says event rate. And so unit yield is, for a given segment, on average, how much was collected per account. So I talked about that conserved segment of segment 1. You can see that in segment 1 here in that 4th row down, $7 was the unit yield. And this was actual client data. And 6% of accounts made a payment, that row right below it with the event rate. So you think about that, right, and go back to what I said about conserve. If you have a segment that's only going to liquidate $7 an account, right, and 6% of the people are going to pay, how much do you want to work against that, right? That's kind of the concept. Whereas when I go to the other end of this map, the segment 5, which was that investment, right, you can see it's 56% of accounts paying, so that's my 50-50. But on average, we're getting $750 an account, right? So I'd much rather take resources and align them against a $750 opportunity than against a $7 opportunity. And that sort of resource shifting through a 120-day collection cycle yields material impact and lift and changes in cash collections. I will pause there for questions. I see people trying to absorb it, so I just want to make sure it makes sense.
Well, and a lot of this, too, is there's other strategies as well, like on the conserve side. Is this something that we know they're going to be difficult, they're going to be hard? Conserve may mean flip them to the vendor, you know, get them out. We don't need to break our pickaxe on them. Let's let somebody else break their pickaxe.
But those strategies are what we define.
Right. We're just giving you the information, saying these are the ones that we see. These are the how you can kind of come up with the strategy of what's the best for us.
And the way we work through that, we tend to think of that as a collaborative process. So there are 3 parts to making a segmentation program successful. So one is having really strong analytics, right? And so we're talking about the second piece is actually designing and implementing. That's a really important piece to this whole conversation, right? So what we need to do is we need to understand what you're trying to accomplish and where in the process. Right? Want to just take cost out of the system? Maximum cash, client situational specific. The second thing that has to come into that is an understanding of what capabilities our clients have. Right? So what do your policies say about minimum number of phones? Do you have blast messaging or predictive dialing capability, right? Can you do outbound to text? Whatever it may be. Your capability sets a framework, right, for what assets we can, what levers we can pull through the process. And then how much staff do you have and how productive they are? All that can come together then in a planning perspective for us to come back and say, okay, so based on what we've seen as best practice for workflow, given your constraints and what you're trying to accomplish, this is what we would recommend. And that becomes a conversation we have together with our client for how to design and optimize that workflow. And that'll be calling strategies, timing of those. You see here examples, right? We can recommend changes to the verbiage you put on your statements if that's appropriate. We can change blast messages and the text for those. So we can go small or broad depending on your appetite. And that can change over time as well. There's nothing to say implementation has to start with everything and change the letters and change the blast messages. We can evolve that, and that's okay. And then the third leg of the stool, right? So I've talked about analytics. I've talked about matching the workflow to your capabilities. The third leg of the stool is going to be a feedback loop, right? And so this is where we're going to take information back from you in terms of payments that have happened on the accounts we scored, so we know how they've resolved. If possible, we'd like to get activity data back from you. Again, these are things which are different than, at least my understanding, of what others in the market do. People don't generally get these close the loop. That closing the loop allows us to do a couple things. It allows us to give you better reporting, right, on how these segments are performing and working. Allows us to match performance with activity and recommend changes over time, right, so we can help tweak that program. Importantly for us, we know that collections is not a static game, right? The economy changes, your patient mix may change, their balances change, your staff changes. How do we think about those changes over time to maximize the opportunity, not just as a one-shot out of the gate, right, step function improvement, but how do we continue to see that grow over time? And so then that's the important third piece. That data also goes back into the second component of the models I talked about, right, which is that historic information. We continue to build that, right? As we get more payment data, our models take that into account and can adjust and reflect that over time.
Question about the segments. So I look at segment 5. Is there almost a sub-segment within that you sort of treat a little bit differently? It seems at the top left of that segment could be relatively hands-off. When you get into the bottom right, that's where you're probably pretty hands-on.
There are ways you could think about that. In general, because we're dealing with so much of the money as an opportunity, our clients generally find it's more effective to blend it all together.
What are the volumes like within that segment? When you get that high, I'm guessing almost like an 80-20 type, where the volume.
I mean, it's only 5% of accounts, depending on portfolio.
Yeah.
So it's splitting hairs for a lot of keys.
You hit them anyway.
Yeah. Because if we think there's opportunity there, it's going to be worth that engagement. And even on the top side of it, right, so if I differentiate there, I want to have an experienced collector talk to that patient, right? It's a big enough balance. I'm looking for enough money that working through that makes sense without letting it be too hands-on. Other questions on that? So we talked a little bit about some of the variations in workflow, but just to give you a little more color on that. So as part of the design and that setup process, that table in the back, you'll see work routines by segment. And so this is where we're going to codify with you, right, over whatever the collection time period is. Is it 120 days that you keep things in-house?
No.
So. Glad I asked.
On the HB side, right, we keep everything in-house from day 0 to 60, and then it goes to our extended business office after that. On professional billing, it goes to the extended business office on day 1.
Got it. Okay. And so
but that could be negotiable. I mean, depending on what we decide to do,
right,
then we may change the way that is, not just everything flows at day 60.
Sure.
Maybe some go at day 0 and others go at day 90 or whatever.
Right. And so we would call something like that in-source, outsource. Catchy name. But what we start to do, if I back up, right, so if I come back to something like this, right, the way we handle that with our clients is a lot of times we take segment 1 and we send them out the door on day 1. Segment 2 and 4, you would keep for the 120-day duration. Segment 3, you probably keep for 30 days because you get some easy, quick payments, and you might as well get that money yourself. But then after that, they actually need somebody to focus on them and leverage their dialers and their capabilities. And segment 5, you probably do keep for 60 days because after 60 days, it's going to take a more professional experience to resolve this. But so you have the ability to start thinking about 2 and 4 as a longer term keep. And get rid of segment 1 even earlier because it's not worth your time and energy. So that all comes with right, designing those work routines and how you want to do it, and it comes back to what's the objective, right, and how do we want to think about that, and what capacity do you have to handle those phone calls. And so we'll work with you to think about that calling grid and the statement strategy that goes behind it, as well as the blast messaging, and even time of day calling. As that's appropriate and something you can influence.
And is the business office extension, is that part of legacy, or is that another vendor that's doing that?
No, it's a vendor.
Okay.
Does that make sense? And I mentioned this idea of capacity planning before. So we have a tool. This is some dummy data in it, but as we go through that process, we obviously want to construct call lists that fit with what you're able to get through. We just give you a score. It's not that helpful. And if we give you a strategy that you can't execute, right, given your capacity, it's not going to be that meaningful either. So we're trying to actually make this actionable to optimize this. And then there are a couple things that we're going to do as well. And this gets into some of the account management routines that you'll see. There is a monthly dashboard you get, which I can flip up here as well in a second. But part of what we do, and Cameron, you can talk to this as well, as the account manager in the room, right, is work with our clients on a monthly and quarterly basis to review performance, help them understand what we're seeing in the data, and talk about other opportunities. What are the things which are working? What are the things which could get better? And strive to continually drive better collections.
Yeah, I think, so I don't want to be redundant, so I won't repeat a lot of what David said, but think of me as the third stool in that leg. So
the third leg in that
stool. Or the third leg in that stool. So I'm going to show you the monthly reports. There's all kind of interesting things in the dashboard that we look for. Make sure that the segments are performing as expected. You know, we can look at tweaking the model or different workflows depending on what those dashboards are telling us. And then on a quarterly basis, we come in and really slice the data in all kinds of different interesting ways to look at it and show that to you so you can make informed decisions on your collection process.
Okay. So vendor management in 15 minutes or less. You just stretching, or are you about to leave?
Just stretching.
That's okay. All right, so vendor management. This is a cloud-based platform that sits between yourself and your outsourced collection partners to help you get visibility and control over what they're doing. And so you can think about that in a couple different ways, right? So vendors that typically we think about putting on the platform are folks like extended business offices, early out vendors, primary, secondary bad debt vendors, insurance follow-up folks, what have you, right? The folks that you're exchanging data with to work accounts on your behalf.
I didn't know the piece about the insurance.
Yes. So we can do it with insurance. We can also do eligibility vendors, motor vehicle workers' comp, international. I'm not sure if I missed any. But it can be a broad set. I will tell you that the majority of our clients focus on the self-pay set of vendors, right, and that self-pay stream from early out or EDO through secondary. But others have chosen over time to add in actually put their own internal business office on the platform as a vendor to get the same perspective and visibility on their operations that they do for their vendors. So you get holistic perspective. Not saying you have to do that, completely optional, but it is something we're seeing more and more interest in amongst our client base. The way this works is there is an IT file layer to the whole thing, which is really important, right, to get all the data flowing and to get it right, and then upon which we build the value. So what we end up doing is taking the feed from our clients in kind of a single pipe to us, and then our platform handles the connections to all the different vendors, which is different than where you are today, right? Because with each of those vendors, so we get some consolidation, and that covers placements, transactions, notes, demographic or insurance updates, what have you, and then information back to you, right, in terms of collector notes and cancel and return files and account location. And it also includes reconciliation on all parties. What?
Payment?
Yeah, yeah, I said transactions, but yes, that's what, and that certainly comes from the hospital to us. We also get that from the agencies.
Well, I meant more by the agency.
Yeah, so bad debt agencies who are collecting that money themselves, they typically tell us about it on a daily basis, so our balances are updated. We generally don't handle the cash, though.
Correct.
So the cash process tends to go around us with their invoices back to you for control. I don't really want to be in the middle of that. I'm glad you agree. We're all on the same page now. So if we have this, so if we've connected all the pipes now, right, and we have all this data flowing through us, now we can do a number of different things, right? So now we can get apples to apples reporting visibility, right, across all your vendors. Right? We can start to code rules against, to enforce your policies and procedures, right? So we can think about different pieces of what that might mean, right? So if a vendor today works accounts from day 60 to day 120 in an EBO context, and then you rely on them to cancel and return that account when they're done, well, now we can actually put that placement period into the period, and we'll issue the recall request on that day 60 for them, right? And so they have to acknowledge that and respond, but we're no longer at their mercy to potentially decide, well, I just want another couple of days, I think I'm going to get a payment, right? And then we can move that account to the next vendor in line and keep the inventory moving. So that's one example of that. Another example is through some of the tools in the platform, we can enforce your payment plan guidelines or your settlement guidelines, or what happens when accounts are found to be bankruptcy or deceased. We codify in these rules your commissions. And so as part of the configuration, we're going to build effectively your contract rates with each of the vendors differently into the platform, so that as we get all these transactions through here, we're going to create effectively an invoice for you, right? Or you can be able to see this is how much I owe a vendor for a given time period, based on an agreed set of these transactions are commissionable, these are not. And at the beginning, we're going to do an audit to make sure everyone's comfortable with that. But then you have a platform which gives you a neutral third-party view about what is commissionable or what is not.
Well, and it's covering all accounts. So all accounts are going to go through there. So you know now, instead of just taking a subset or a sampler of 100 accounts, you know that all of your accounts are going to be running through that filter to say whether or not they're being commissioned correctly per your contract.
Conceptually make sense? As part of this, there's a lot of reports. I'll show you some of them in the demo in a second. The other piece that we do with this, like we talked about on the segmentation solution, there is a monthly dashboard that comes with this, and that is going to be by delinquency stage, so you can get an overview at a glance of a number of performance metrics for your vendors in early out or very bad debt. And then we're going to sit with you on a quarterly basis to go through a deeper dive of trends that we see, and opportunities for how to either change that vendor network, how to engage with your vendors differently to drive different performance, or maybe there are process opportunities that we're identifying based on vendor performance that are actually items under control of the business office. Right? So if we see insurance slipping through and lots of insurance being captured by early out or by primary, or if we see an escalation in days from discharge to placement, right? Those types of metrics that we'll start to have some visibility to, we can actually bring that to your attention and engage in a conversation about it.
So again, that's my role.
Yeah. We can also look at what vendors are providing better outcomes with different types of accounts. So say for instance this subset of accounts, this vendor A is better at these accounts and vendor B is better at the other subset. And so instead of handing them off maybe through an alpha split, we can give you a better strategy in how to outsource those accounts to those specific vendors. They're better at the early day low dollar accounts, or their phone calling is a lot better than vendor B, and kind of give you some of that insight to again really start to create those strategies necessary to make them as efficient as possible for you.
Okay, so quick overview of the platform itself. So this is something that you would have access to and be able to log into to cover both reporting It actually has information about files, reconciliation, as well as work used in terms of a communication portal, which I may not have mentioned on the prior page. So that's a way for you to communicate with your vendors about accounts that either you need to tell them something about, like, I need to recall that account immediately, or they want to ask you for, I need additional information, or I found insurance, or this is bankruptcy or deceased, or I want approval for a payment, or whatever it may be. And so you would do that through this portal as well. What you see here on the screen is the dashboard when you log in. It is perhaps not your standard solely performance-oriented dashboard. Our view of vendor management is the results certainly matter, and we do look at collections, right? And you want to see collection trends, and you can see here, right? In the night, and if we have a spike, or we want to be able to see that quickly. Right? We don't want to wait for month-end reporting to see that. We are going to monitor recon errors, right? And so this will be a trend line, so you can see kind of what's been happening, and that's going to be recon both between Epic and us, but also between us and each of your vendors, right? So you can start to understand where data integrity errors may live. Work use. So this is that communication portal that I talked about. Here are a couple examples of types of categories of requests that come into the system. The bubbles on the right aren't always red. They do go red, yellow, green, depending, but that becomes an indicator of how responsive the hospital is being to a number of these requests. So how long have they been sitting there in a pending state? This gives you a way to hold yourselves accountable to your vendors and ultimately your patients, right, to engage in that process and get vendors answers that they need so they can resolve your patients' questions most quickly. The other piece in here is account activity. So as we connect vendors to the platform, one of the things which we do is, while we'll continue to get their free-form collector notes, right, so which I assume they send back and you pull back into Epic, we're going to ask them to create a structured activity file for us. So what that means is, instead of us having to parse through all the notes, we want them to tell us, did I send a letter or send a statement? Did I give them a final notice? Did I make a phone call? Did I get a phone call? Did I get a promise to pay? Whatever it may be. And we want that structured activity data. That allows us to do some interesting things now, right? So one example here is accounts with activity after closure. So this is a report which is saying, have these vendors made an outbound attempt on an account that they previously told us was closed? That should be a red flag for everybody in this room, right? But when we get detailed data, you can start to track things like that. Other pieces of this puzzle, things like overdue recalls. So I mentioned that idea before. We'll code that placement period into here. This is that exception, right? So this says, for these different vendors, right, you can see there are an awful lot of them. That says we issued a recall notice to them, and they haven't acknowledged that. So they're still working the account after you requested it to come back. All that kind of makes sense? Questions?
So in this portal, some of the data, like you're expecting to be expecting daily from Epic, and the expectation of the other collectors is that they would also be providing daily data and the structured activity and whatnot.
We want that daily.
How many different collection agencies have you worked with to get that data, and have you had any challenges with that?
It is a good question. So the answer is, I think we have 80 or 85 vendors on the platform today. All those vendors connect in a standard interface to us, so it's all and yes, we've had challenges with them. Not all of them, right? As you imagine, right, the technical capabilities of vendors is varied.
Widely.
Yeah, And so that's part of it, right? Some of them, right, say they can't do the structured collection activity data. Now, quite frankly, like, if they can't get at their activity data, I don't know how they're managing their operation or how they're giving you a perspective that they're in compliance, right, with your policies and what you're asking them to do. So that's a huge red flag for me regardless. Others, so it varies, right? The other piece of this, though, is how vendors view this platform, right? So this platform definitely has some Big Brother aspects to it, right? And it's not intended to be Big Brother in this whip to the agencies, right? It's actually supposed to provide transparency, so you both see the same data and you get the same understanding of what's happening, and so it becomes a common base of reporting. Then you can have trust and you can actually discuss how do I move the business forward for both of our interests, as opposed to vendors showing up monthly saying, here's my reports, I did really good, and you don't know. Vendors have a different perspective on that, right? Some of them relish that and love it and say, yep, I'm great. I'm happy to engage in that conversation. But when I show you how good I am, I get more business, right? And that's good for me. Others say, I'm not so sure I want to play in that sandbox, and then it becomes up to you guys to make a decision about whether you're going to require that participation or not.
This is not a, this wasn't a monthly report set that gets forwarded to us. This is something that was always at our fingertips.
This is always
Well,
That includes a monthly dashboard.
Yeah. So what David's showing you right here is actually the actual product itself.
Real time.
Right.
Yeah.
So real time, you can get access to the accounts, you can look up the accounts, you can get the reports, whatever it may be. We do the monthly dashboards and monthly reporting pack. It's actually going to go in and do that. Better or worse. Amanda will. No, you're going to go in. So.
No, I like it because we have some of those issues, and it would be really helpful. It used to be painful. It's now painful for Michelle, but I think so for our because the lack of reporting there is the reporting is antiquated. So something like this would be really helpful in understanding what's happening.
So this is, so let me just do a couple minutes left because I'm trying to stick to my 15 minutes on this topic. But if you guys tell me what. The reporting in here is divided primarily into 3 tabs. So performance analysis, which is results oriented. Placements and closures, which is going to be kind of inflows, outflows. It's also where I'll show you some of the recon. And then activity monitoring, what's actually happening. All of it is set up in the same way as questions, so you can see what we've pre-populated some of those answers to make it easier to get to the reports you want. And let me just give you an example and show you kind of a flavor for the ability to slice and dice this. So this is a collection calendar months report. You might call it a step report, you might call it a triangle report, lots of different names for it, right? But each row on here represents a month of placement, and then as you go across, the columns show the collections that happen in the calendar month. So you can follow the liquidation bill for a vintage. If you're in this portal, you can now also get access to slice and dice that data in a number of different ways. So some clients are going to say, well, I want to understand what's happening with my low balance accounts or my high balance accounts, right? How are they doing on those? Okay, that's an interesting question. I want to understand balance after versus uninsured, right? So I can start to piece that apart. Another piece which becomes interesting, this comes back to your question from before. You can run this to see the patient or the insurance payments, right? So if you want to understand that composition, you can get into it. And so this is a feel for the types of things you can do with this reporting. And then there is a commission overview. So this basically answers the question, how much do I owe a vendor for last month's commissions? The way, and then, oh, there we go. So the simple report, right, which basically says this is based on all the transactions that came through, what do we think is commissionable and how much should you pay? What what we do as part of the implementation is we're going to do probably 2 in the first 4 to 6 months, line item audits of vendor invoices against what our platform says. And that's going to allow us to validate that the rules we put in place are accurate, and any issues, whether they're on our side or perhaps the vendor side or misunderstanding about the contract terms, can all get clarified. And then that enables a different conversation about invoicing, right? Because now you can say to the vendor, well, I expect this to be the amount, and everyone's on the same page with that.
And if it's not, now the onus is on the vendor to describe why and help you understand why is it not. If we agreed that this is equal, why are you off? Instead of the onus being back on you.
Right.
That's an interesting and helpful piece, I think. And there's a lot more conversation we could have about that, obviously, as we go through that. But right, there's a lot of work to figure out if the invoices are right. This also allows you, if you're kind of running up to the end of the month and need to book the accrual for accounting purposes, you'll know where to stand for month to date. So you could project that out too. These are some of the questions and types of reports on the placement side. I obviously don't have time to go through all of them, but just to give you a feel of what's in here. And just as an example, right, an aging report, simple kind of how much inventory is sitting in 30-day buckets, right? So you can get at that. And if you wanted to think about that again, different types of accounts, you could do that. Interestingly, depending on how you think about reserve schedules versus your agencies think in terms of days from placement, right, which is kind of the default here. But if you want to understand how that aging is working on days from discharge because your financials run on discharge dates as opposed to placement dates, you can start to understand some of that as well.
Are there any other options for this?
On this one,
I mean, we might also think of it more as than self-pay bills.
yeah, we don't have that right in here.
Do you want to show the activity where what accounts you think are being worked and what accounts are actually being worked?
So activity here, a number of the questions you can look at both what the vendors are doing, what's compliant. You can understand work queue usage. So are vendors using the work queues consistently and appropriately, or are you denying lots of work queues? And you can also see some staff productivity. The one Walter's pointing me towards is time since last activity, which essentially, once we get the data from the vendors about their calling activity or their statement activity, we can now pull up a report that says, when were these accounts last worked? And so this becomes a view, and so this is demo data, right? But so to make a point, right, here's a set of accounts that were placed 46 to 60 days ago. There's 2,254 of them still open, right, with that vendor or with all these vendors. And 2,106 haven't gotten a phone call yet. Right now, if you saw this in real life, right, you'd probably be screaming, but right, you can start to see some interesting patterns. You can click into any of these numbers that are in blue and underlined, so you can get the list. And if you want to get more details about any of those accounts, that pulls it up at the bottom. And you can see a whole bunch of different information about that, right, from transactions, the itemized collection activity, to the notes we have, even to other related accounts that may be there. So we're trying to put a lot of information at your fingertips in the platform in a pretty easy to get to manner. The other thing I will mention about this is everything you see about a vendor, they can see about themselves, right? So you have transparency. They can't see their competitors' data. So if you have two people side by side or they're not working that account, they can't see it for security restrictions. But they can look at this data themselves, so they can be monitoring their own performance on the metrics, on their activity, what have you. So you're not solely responsible for that.
That reminds me who administers this portal.
In terms of users, and you can. We can set that up for you, or our support desk adds users all the time. And Cameron's happy to help you out with that. And we maintain all the rules in the background.
The other nice thing, and just real quickly, I know we got to move on to the next section, is that some of the reports we can do is also give you an idea of, okay, here's how your vendors are performing amongst themselves, but how do they look across the other 85 vendors that we're working with across the country, and give you some understanding as to how they are, and what they're doing and how good they are, and so that you can understand, maybe I do need to make a change, or maybe what I thought was adequate isn't adequate, and I need to start looking. And then we can give you a lot of that detailed information to show you, hey, they're on our platform, this is what we're seeing in typical areas that are similar to yours here in Portland, this is what we're seeing, how they're functioning. And that gives you a little bit better understanding of what you're looking for, and instead of just going to RFP and having them give the answers of, hey, yeah, we're all great, what are we really seeing?
Anything else on this? Otherwise, I'm going to...
Can I just say one thing, because I get questions about it all the time?
You can. Well,
All those
I
reports
relocated
in here as well. You can export them out of the platform, so you can put them into Excel and run all your pivot tables or whatever you want on those reports. So I get that question all the time.